Now let's talk about OASIS item GG0170, which focuses on a patient's mobility. And just like GG0130, this is an item that carries real financial, performance, and compliance implications for home health agencies.
GG0170 is part of Section GG of the OASIS assessment, and it measures a patient's ability to move safely and functionally at the start of care. This includes activities such as rolling left and right, sitting to lying and lying to sitting, sit to stand, chair or bed transfers, toilet transfers, walking short distances, walking longer distances, or using a wheelchair, and navigating steps or uneven surfaces when applicable. Each activity is scored based on how much assistance the patient truly requires, using a standardized scale from independent to fully dependent, including appropriate use of not attempted codes when clinically justified. GG0170 impacts reimbursement. First, GG0170 directly influences PDGM payment. The mobility scores are combined with GG0170 self-care scores to determine the patient's functional impairment level, either low, medium, or high. That functional impairment level is a key component of the PDGM case mix adjustment, which means GG0170 helps determine the clinical intensity Medicare expects and the payment rate for the 30-day episode. In practical terms, higher mobility impairment equals higher reimbursement, and lower mobility impairment equals lower reimbursement. So just like with GG0130, undercoding mobility limitations results in lost revenue, and overcoding mobility limitations increases audit risk. Accurate scoring protects both sides. Secondly, GG0170 plays a major role in value-based purchasing outcomes. Medicare tracks improvement in mobility from start of care to discharge as part of value-based purchasing. If GG0170 is scored inaccurately at start of care, the agency may not be able to demonstrate improvement at discharge, outcomes may appear flat or negative despite good care, and value-based purchasing performance scores can suffer. This directly impacts future reimbursement adjustments, incentive eligibility, and the agency's star ratings and public reporting. Therapy alignment and operational risk are other things to consider. GG0170 is one of the most therapy-sensitive OASIS items. Because it reflects functional movement, nursing and therapy assessments must align. Start-of-care scoring must reflect what the patient can safely do, not at their best moment or on their worst day. Misalignment between nursing documentation, therapy evaluations, and other visit notes creates internal confusion and external risk during audits. GG0170 is a high scrutiny audit item because mobility limitations are observable and measurable. Documentation inconsistencies are easy to identify, and scores must be defensible across disciplines. Auditors frequently look for logical progression of mobility improvement, consistency between GG0170 scores and visit narratives, and appropriate use of assistance levels and devices.
So here's the bottom line. GG0170 directly affects PDGM reimbursement, value-based purchasing performance, and audit vulnerability. It's not just a clinical measure, it's a core revenue and risk indicator. Agencies that consistently score GG0170 accurately and defensibly capture appropriate payment, show meaningful mobility improvement, and reduce audit risk exposure. Agencies that don't often feel the impact later in denials, repayment demands, or missed incentive dollars.